morning. I'm Lori Powell, and I really appreciate you being here today with us. I'm going to be talking about something that's near and dear to my heart, and that's, first of all, cancer survivorship and low health literacy. Low health literacy is a problem, and it's not really literacy itself, but it's compounded on that. And lots of times people with low literacy also have low health literacy. And that's really the capacity to obtain, process, and understand basic health information and services to make appropriate health decisions. That also includes mathematical skills or numeracy literacy. So those people have to figure out how to use prescriptions, how to read them, how to interpret when to give them. If the doctor says, take 2 pills every 4 hours, 5 times a day, that can be confusing to people. So we need to be thinking about that. You know, I think it's interesting to note that most people in the United States have low health literacy. In fact, only 12% of the people in the US are proficient in health literacy, so can get themselves through a understanding how to navigate the healthcare system. And you can see the different layers in terms of 22% are at the basic level, 14% are at below basic. So that means these people really have a hard time understanding what we're going to be talking about as healthcare providers. And sometimes it's what we call onco-speak, so that people really don't have any idea what we're talking about. This morning, one of the key speakers said that he asked the nurse after the doctor told him what was going on, what that meant, because he really didn't understand what the doctor was talking about. When we think about some things that we want to be considering for low health literacy, some red flags we ought to consider, first of all, is frequently missed appointments. I know of a patient, and he missed his CAT scan 3 months after he had a previous one because he thought, well, I just had one, so I don't need another one, where in fact they wanted to check his progress after therapy. Incomplete registration forms, many times that people aren't able to understand the registration forms. Non-adherence to medication. I read something today that a woman's child had an ear infection, and the doctor gave her some medicine for that. So she read the instructions, didn't really understand, just poured a teaspoon and then put it in the child's ear. So she really didn't have an understanding of how to read the medication and the appropriate use of it. They're unable to name their medications or explain the purpose. They identify pills by their appearance and not really their labels. They're unable to give a coherent sequential history when they come first, they present to the doctor, and there's no follow-up on tests or referrals. And so they tend to ask fewer questions. They often feel embarrassed to say that they can't read, or embarrassed to say that they don't understand what the doctor just told them. So when you think about low health literacy and cancer survivorship, you can appreciate that this is a real problem. One of the things we want to have is screenings and checkups after patients have finished treatment. And oftentimes people are just lost to the hospital providers. They may not, again, adhere to the cancer treatment plan itself. They, again, may have increased post-hospitalization visits, including the emergency room. Many patients use the emergency room as a primary care place. And also they may not be able to really communicate well with the healthcare providers about what's going on with them, whether they have new symptoms or that kind of thing. I wanted to quickly go through this chart, and this is, we know that we use survivorship care plans with patients once they've completed active treatment. I just took 2 survivorship care plans that are well known to us, ASCO and Livestrong, and looking at these various instruments to assess health literacy, you can look at in various tests. ASCO was difficult to read, used at the college level, 12th grade level, college, and on and on. I come from Louisiana, as I said, 30% of the people there read at the 5th grade level. So you can see that these survivorship care plans are going to be difficult for people to understand. The Institute of Medicine put out a whole module on health literacy and what we can do to end this confusion. And some of them, they call for the idea of universal precautions. And that's because everyone, as I told you, only 12% of the population in the US feels comfortable with understanding the healthcare system. So what we want to do is use clear, direct communication. The teach-back method, or ask the patient to tell you what you just said. Follow-up check in on the patient's progress. You may want to call the patient and see how they're doing. You want to review the medications with them and supplements to make sure that they understand, and ask patients' preferred language and use interpreters if you don't have someone who speaks their native language. So these are all really important. These are only some of the strategies you can use to help patients with low health literacy, but it's really important that patients understand. Well, thank you so much for your kind attention. I really appreciate talking with you today. I hope I've raised your awareness about health literacy, especially as it relates to cancer survivors, and you'll consider this in your practice in terms of what specific assessment areas you want to address, as well as strategies specific to helping patients have a greater understanding of healthcare and how to manage the healthcare system. Thank you.